Okay, we are going to review accessing and deaccessing an AV fistula or graft. The supplies you need are your two needle devices, your grip lock, your Castile wipe, and your chlorhexidine wipe. Okay, so Shannon is going to be our facilitator. So first thing you want to do is assess your site. So you're looking for redness, swelling, hardness, scabs, things like that. If you see any of that, you want to go around that. We're going to be palpating for our thrill. We're going to feel the pulse. We're going to listen for a bruit. Want to hear a nice even flow, and you want to check the entire access fistula graft, whatever. You want to see where it starts and where it ends. So now we've inspected it. We know that looks like it's going to work. So we're going to clean it with our Castile wipe. Give it a good rub. And then we're going to use the chlorhexidine. We're going to activate it. Make sure it gets good and soaked, and soak your site. It's good. Now you want to let that dry for a minute or two, and you can get your preparation started while you're waiting for that to dry. And you, of course, make sure you have already put a chuck underneath to check from any splashing. You're going to wear eye protection because you can splash. So we're using the grip lock. Okay, the grip lock should always be used unless the patient refuses. We pull one side off and attach it. Go a little closer. That way.
Up more.
Get to the edge. That's it, right there. Okay, and just fold over to one side, and then you take off the other. You peel the other backing off, and do the same thing with the left side there. Okay. So then we fold the wings up. It kind of breaks up the other sides for you. You don't have to take them off yet. But then you go and your site should be dry by now, and you pull your needle off, bevel up, and we are going to insert, depending on if it's a fistula, you want to do it at an angle that you just did. If it was a graft, you go in a little deeper, a little greater angle. So now we want to pull the side tabs off, just one at a time. And it's a little harder with the mannequin because it's hard. The mannequin doesn't give like a patient that gives. So an important piece right here is you have to fold over one of the tabs each time. Like that tab there, and again on the other side. And this will help you take these needles out when a 4-hour treatment is done. Nothing worse than having a patient scream because you're picking at their skin, trying to get the needles out. So here we go again. You can watch Shannon do it again. And like anything else, the more we do it, the easier it gets. There you go. Hold it up. Okay, so now a big deal is we're finding that our sites are too close together. They've got to be, if you have small hands, you've got to be 4 inches, at least 4 inches apart, or 4 fingers apart. They want us to do 3 inches, but 3 inches is kind of far when you're trying to place the, and try and take them out and together at the end of the treatment. So 4 finger lengths, don't contaminate your area, and then do it again. If you have large hands, 3 finger lengths is probably plenty. My fingers it works fine. Again, fold over, tab, make a tab on the end, make a tab on the other end. Excellent. Okay. Now we have, patient is, lines are secure. That's not going anywhere. Okay. So now, okay, fast forward to the end of the treatment. Here we are. We have our, okay, so your supplies here, we have 4 2x2s and 2 alcohol preps. Okay, so we're going to deaccess, we're going to pull the needles from this patient. We're already off the machine. So get some alcohol, a couple alcohol swabs, and you want to try to make sure you hold the needle as you're pulling up. So one way you can do that is using one hand to hold the needle, and the other hand to just, there we go. Once you have that tab started, you can hold the tab at your fingers, and it actually works. So fold over the loose tab there so it doesn't get in your way. Try that. There you go, see? And you may not have to use much alcohol at all. It depends on the patient's skin and how it is. So once you have that, you get your gauze. And then we just squeeze the connector release and pull the needle. Maybe not twisting so much, but don't want to tear up the patient's line there, but that's all right. The dummy here has very tough skin. So, okay. So now this is the hard part, pulling with the, still holding pressure on the one site, and you're starting on the second site. Now you see how Shannon's using one hand to hold and the other hand to loosen. She has the alcohol. She's actually holding the needle with her fingers. She's holding everything with her one hand. It's very nicely done. Get your gauze. And gently pull it out. There you go. Then you wait your 10 minutes and put the Band-Aids on. We like to use, you can use 2 on each site, but you don't have to. You can ask the patient. All right, thank you.